The future of SIGN is to assume a greater and greater role in the world. Our vision is creating a quality of fracture care throughout the world. In other words, we think a fracture that occurs in Bangladesh should have equal chance of healing there as it does here in Richland, Washington. We think that a surgeon in Bangladesh should have an equal opportunity to treat his patients with instruments and implants that are as effective as the implants we U.S. surgeons use. So equality is really a big part of SIGN.
SIGN has changed the face of orthopedics throughout the developing world because we are providing the tools necessary for the orthopedic surgeons to treat their patients.
If there were no SIGN nails, more than half will not have any form of treatment. Another half may have some form of inferior treatment, either on traction or with plates. Till most of the patients who have these fractures are often men, and in that case they are family heads, so they support their families from their daily income. So any day they are not able to walk by themselves or go to their farms or get involved in their daily activities, that means lost earning for that family. And that means they can't provide for their family, they can't feed their kids, the kids can't go to school, and it's just a whole cycle of poverty, disease, malnutrition and stuff like that. So that would be very devastating, yes. You know, in most hospitals, whichever surgery you want to do, you think about cost. Can this patient afford it or not? It is very frustrating as a surgeon. You have the skill, you have the patient, but you can't do the surgery because you are limited by patient's inability to pay or the hospital doesn't have the equipment.
This nail or SIGN in general has allowed us to use or incorporate our desires to help these poor patients and put them into action. So we could not just be pathetic, sit in a corner, say, you know, I wanted to, but I can't. With SIGN coming in the picture, yes, we can.
I feel very good. That is why we are working with SIGN, because you know, it's great to remove the pain or misery of people. Being a doctor is satisfying, it's rewarding to me. That's all why we work with SIGN.
I think if people understand that you must not give $1 million to SIGN to make a difference, any little bit of money you give to SIGN is, you are not helping an individual, you are helping a whole family to be able to support themselves. Most people who have fractures are those in their active period of life. If you donate money to SIGN so that such fractures can be fixed, you've helped maybe a family of 5, you've helped someone to be able to have money to keep sending his kids to school, you've helped a family to be able to have food on the table that evening. So I think there is a bigger picture in contributing to see that SIGN continues to have the implants or make the implants to donate to countries that are less fortunate.
So many times we've arrived just when a patient arrives at the hospital needing the new device that we're coming to show their surgeon. And this last trip that we made to Tanzania was no different. We came with the new pediatric nail. And it just so happens that Martha came into the hospital the same day that we arrived. She's a 12-year-old orphan whose parents died of AIDS before she was 1 year old. She lives with her grandmother who can barely afford to keep her in school, let alone pay for a device that will fix her femur. Her surgeon said if she hadn't gotten that nail, she would have been left in traction and possibly would have become crippled. That's a disaster for a child, especially a young girl, because they're left as outcasts, and that means she wouldn't have been able to get married, return to school, and get a better education so she could get a job that would provide for her and her grandmother in her old age. So we just thank our donors so much for giving us the support that we need so that we can provide little girls like Martha with implants like this that give them a chance for a new life. Your gifts heal.